I first got the laser, I started doing modifications of going into a pocket without a flap. That was not easy for me because I had grown up and also created a graduate program around periodontics for 16 years where we truly listened to research. So it took a little bit of a leap of faith for me, but then I began to realize that we already had a natural incision. It's called a sulcular pocket entrance. And then as I began to do certain procedures, there's one thing though that I always kept in mind. My dad was a coach. And if you've ever been in athletics, there's something that always predominates no matter what. You can have the best running shoes, whatever, and that is fundamentals. The difference between what we do and maybe other systems that are out there is that we've never lost fundamentals. We know what it takes. We know about root surfaces, we know about gum tissue, and so repair is a modification of basically what we have been doing, but it makes it in such a minimally invasive scenario that that's where we win. Again, I want to preface that traditional periodontal surgery works. Repair necessarily doesn't work better from a clinical outcome standpoint than traditional surgery, except for two things. Your patients love you. Your patients take minimal medication. Your patients get up the next day, they go to work, and you know what they do? They tell other patients about laser. And eventually what we want a patient walking into a dental office and saying, I want laser. That's what I want. And then the other thing that we found with repair is we weren't getting gum recession. So we were able to save teeth in the front or when someone smiles and not see those big black triangles. So when we put all of that together, we knew one thing: we had to find the right wavelength that was going to make that happen. Waterlase had that wavelength. And that all tissue laser is what makes this thing hum.